lungs, right lungs is quite heavier than the left lung. Okay, right lungs আমরা কি কি ফিচার্স পড়েছিলাম? What are the features? Okay, first আমরা পড়েছিলাম apex. So apex is the superior most part of the lung. This is the apex of the lung. This is the apex of the lung. Okay, so therefore this is the apex, and the base part is quite wide. Okay, base part is the quite wide, and then the apex part, and this is the superior most part of the lungs. Okay, and this is the base of the lungs, or the diaphragmatic surface of the lungs. Okay, this is the base of the lungs, or the diaphragmatic surface of the lungs. Then sometime examiner asked, how you identify this is the right lung and this is the left lung? Your answer is, the right lung consists of 3 lobes. This is the superior lobe, this is the middle lobe, and this is the inferior lobe. Superior lobe, middle lobe, inferior lobe. So 3 lobes is divided by the 2 fissures are there. One is oblique fissure, another is the horizontal fissure. This is the horizontal fissure, and this is the oblique fissure. This is the oblique fissure, this is the horizontal fissure. Okay, so this is the right lung, and the left lung. Similarly, this is the apex of the left lung, this is the base of the left lung. Okay, this part is the base part, this is the base of the left lung. Okay, and this lung has 2 lobes, superior lobe and the inferior lobe, the one fissure. This is the oblique fissure. So right lung consists of 3 lobes, 2 fissure, and left lung 2 lobes and the 1 fissure. 2 lobes and the 1 fissure. Okay, then আমরা এপিক্সটা বুঝতে পেরেছো সবাই? এপিক্স অফ দ্য লাং কোন জায়গাটা মৃণাল? Where is the apex of the lung? This is the apex of the lung. The examiner asked, where is the apex of the lung? Okay, the examiner asked. So এবার এই পয়েন্টে কিন্তু অনেক সময় পিনও থাকে, এই পয়েন্টে অনেক সময় এক্সামিনাররা পিন দেয়. So this is the base of the lung. Okay, or the diaphragmatic surface of the lung, or the diaphragmatic surface of the lung. So we have to hold the lung in like this way. We have to hold the lung like this way. So what is the side determination of the lung? What is the side determination of the lung? So you have to first give answer under the against the superior or inferior. Bolo superior apex is the apex. Superior apex, inferior is the diaphragmatic surface of the lung. Some author describe as the base of the lung, some author describe as the diaphragmatic surface of the lung, or some author describe as the inferior surface of the lung. Same. Okay, then so this is the superior, this is inferior. Clear? Then the medial lateral, how you identify? Bolo medial lateral, how you identify? The laterally their presence of the impression of the ribs. দেখো তুমি যে ফিসারটা বললো, ও যে ফিসার বললো, ফিসার কিন্তু এদিকে অনেক সময় দেখা যাচ্ছে. সো এক্সামিনার তোমাকে কিন্তু ক্রস কোশ্চেন করবে, ফিসার বলবে না. সো ল্যাটারাল সারফেসের মধ্যে দেখো ইমপ্রেশন অফ দ্য রিবস. সো দিস সারফেস ইজ কল্ড দ্য কোস্টাল সারফেস. So this surface is called the costal surface, because the costal surface, I understand this surface is the costal surface because of the impression of the ribs. Okay, so these are the impressions. These are all the impressions of the ribs. Very clearly said. Yes, these are the all are the impressions of the ribs. Okay, so these are the impressions of the ribs. Then this is the lateral. Then the medial, how identify? Medial you identify because of the presence of the hilum. The presence of the hilum of the lung and the pulmonary ligament. This is the hilum portion of the lung, and this is the pulmonary ligament. This is the hilum and this is the pulmonary ligament of the lung. Okay, similarly here is also present the hilum of the lung, and there is presence of the pulmonary ligament of the lung. Okay, so hilum and pulmonary ligament presence medially. So with this structure, with the hilum of the lung, what is the hilum of the lung? What is the root of the lung? Yes, Answer is correct. Root of the lung. Some structures enter into the lung and some structures exit or go away from the lung. So this is the port. So this is the port of the lung. In the liver, the hilum of the liver is called the porta hepatis. The hilum, this is the hilum of the lung. So some structures enter. যেমন trachea enter. Okay. Trachea enter করছে। আমি বলছি। Trachea enter করছে। Trachea আমি সব বলছি দাঁড়া। So medial lateral হলো anterior, এবার anterior posterior how identify? আমরা last ক্লাসে বলেছিলাম anterior border is wide sharp, then the posterior border. Posterior border is blunt, and near about the posterior border, their presence of the rib impression is there. Their presence of the vertebral column. From which to which vertebral column? From T7. That means the 7 thoracic vertebra to 10. Sorry, C7 to D10. That means the 7 cervical vertebra to 10 thoracic vertebra. 10 thoracic vertebra. So this is the lateral, this is the medial, this is the superior, this is the inferior, and this is the anterior border of the lung, and there is presence of the posterior border. So anterior border is sharp. Anterior border is sharp. This is the sharp border, and the posterior border is blunt. Posterior border is blunt. Okay, posterior border is blunt, and the anterior border is sharp. But in case of left lung, the anterior border is interrupted. The anterior border is interrupted by the cardiac notch and presence of the lingula. Lingula means have a look. This is the tongue-like process. This is the tongue-like process just below the cardiac notch. Just below the cardiac notch, that presence in the anterior border of the left lung. That presence in the anterior border of the left lung. This is the anterior border of the left lung. This portion is the cardiac notch. This portion is the cardiac notch, and this process is called the lingula. This is the looking like the tongue shape. This is the tongue shape. Okay, so this is the tongue shape or the lingula. Lingula. Okay, so this part is present just below the cardiac notch. Sometimes they give the pin on the lingula. They give the pin. Last year তোমাদের সিনিয়রদের যে অ্যাডজাসেন্ট যে সিনিয়রদের যে এক্সাম হলো ওখানে এক্সামিনার অ্যাপেক্স অফ দ্য লাং এ দিয়েছিলেন, এন্টিরিয়র বর্ডার অফ দ্য লাংস এ কিন্তু দিয়েছিলেন। আর একটা পয়েন্টে দেয় খুব বেশি, সেটা হচ্ছে পালমোনারি লিগামেন্ট অফ দ্য লাংস। জাস্ট বিলো দ্য হাইলাম অফ দ্য লাং দেয়ার প্রেজেন্স অফ দ্য পালমোনারি লিগামেন্ট. This is the hilum of the lung. This is the pulmonary ligament. This is the pulmonary ligament. So this part is also important for the identification point for the and also for the viva. Okay, তোমাদের এক্সামে থিওরি এক্সামে যেটা কোশ্চেন ম্যাক্সিমাম আসে, the description of the mediastinal surface of the lungs. That means the surface of the lungs. So this is the apex, this is the base here, this is the base of the diaphragmatic surface. Okay, this is the base of the diaphragmatic surface, because this part of the lung is rest on the diaphragm, right dome of the diaphragm, and this part is related with the right lobe of the liver, right lobe of the liver, and this right lobe of the liver is separated from the right. Yes, right lobe of the lungs. It is separated from the right inferior surface of the diaphragmatic surface of the right lung by the right dome of the diaphragm. Okay, so this part is related with the right lobe of the liver, and this part is related with the fundus of the stomach and the spleen. The fundus of the stomach and the spleen. So this part is separated by the left dome of the diaphragm. This part is separated by the left dome of the diaphragm. Okay, so this is the right lung, this is the right lung, and this is the left lung. The weight of the right lung approximately 700 gram approximately, and the dome of the 650 gram. Okay, the weight of the left lung is the 650 gram. Okay. This person, there is blackish spot, mottled spot. তোমরা যদি আরো ক্লিয়ারলি দেখো, ডট 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 করে অনেক স্পট দেবে। আবার স্পট গুলো হেভি স্মোকার হলে একটা স্পটের সঙ্গে অন্য একটা স্পট জুড়ে যাচ্ছে, একটা স্পটের সঙ্গে অন্য একটা স্পট জুড়ে যাচ্ছে। So this person is, this is the male lungs, this person is smokers. So আমি লাংসের থেকে তার একটা সে কি নেশা করতো সেটা কিন্তু আমি একটা আইডেন্টিফাই করতে পারলাম। সো এটার সঙ্গে সো ফরেনসিকের সঙ্গে রিলেশন থাকে, ফরেনসিক মেডিসিনের সঙ্গে। সো পার্টিকুলার কোন পার্টে ইনজুরি হয়েছে, কোন পার্টটা কেমন ইনজুরি হয়েছে সেটা কিন্তু দেখলেই কিন্তু বোঝা যাবে। ঠিক আছে, এটা this is the male lungs, that because this is quite heavier, this is quite heavier, and the impression of the ribs are very very prominent. Okay, impression of the ribs are very very prominent. এটা, so this is the male lungs. আর ফিমেল স্মোকারও হয়, এটা নয় যে ফিমেল স্মোকার হয় না, মেল স্মোকার হয়, বাট মোর কমন ইন the male smokers. Okay, then our description is the mediastinal surface of the lungs. That means we divide the surface. This is the costal surface of the lungs, this is the medial surface of the lungs. The medial surface of the lungs is again divided into two areas. One is the mediastinal surface of the lungs, another is the vertebral part of the medial part, the vertebral part, and another is the mediastinal part. Medial surface divided into vertebral area and the mediastinal area, and this is the diaphragmatic surface of the lungs, or the base of the lungs. Okay, so the mediastinal surface of the right lungs, mediastinal surface of the right lungs, it is related with the mainly right atrium of the heart, right atrium of the heart. So this part is related with the right atrium of the heart. See, this part is related with the right atrium of the heart. So which vessels is drained into the right atrium of the heart? Tell me. Superior vena cava and the inferior vena cava. So here is the impression of the superior vena. So there is the impression of the superior vena cava, and here is the impressions of the inferior vena cava. So there is impression, maybe there are impression of the mediastinal surface of the lungs are there. With the impression, you have to describe the impression of the area, mediastinal surface of the lungs. So this is the right, this part is related with the right atrium of the heart. So right atrium, two vessels, large vessels, 10. One is the inferior vena cava and that is the superior vena cava. So where is the inferior vena cava? Below anterior part of the hilum of the right lung. So this is the below, this is the anterior portion, this is the posterior portion of the hilum. Okay, this is the anterior portion and this is the posterior portion of the hilum. This is the pulmonary ligament. So there is presence of the inferior vena cava impression, and here is the superior vena cava impression. Superior vena cava impression, and the ultimately the superior vena cava is formed by the right and the left brachiocephalic vein. Ultimately, tip point is this part related with the right brachiocephalic vein. Right brachiocephalic vein. So আমরা এখানে ইনফেকশন থেকে চারটে পয়েন্ট আমরা জানলাম। আবার দেখো বলছি, this is the right atrium of the heart, this part is related with the right atrium of the heart. So there is impressions of the right atrium. Then second point is that there is the impression of the inner vena cava, and there is impression of the superior vena cava and the right brachiocephalic vein. যদি রাইট ব্রেকিওসেফালিক ভেনের কথা ভুলে যাও অসুবিধা নেই, কিন্তু সুপিরিয়র ভেনা cava মনে রাখতেই হবে। ওকে, then sometime examiner asks how the superior vena cava is formed and what is the impression related with the superior vena cava. Then your answer is the superior vena cava is formed by the right and left brachiocephalic vein. Sir, here is impression with the right brachiocephalic vein, because the superior vena cava is formed by the union of the right and left brachiocephalic vein. Okay, So there is right atrium, inferior vena cava, superior vena cava. Then one vein drains into the superior vena cava. One large venous channel which arches over the azygos, which arches over the superior part of the superior part of the hilum of the right lung, superior part of the hilum of the right lung. So this portion is called the impression of the azygos vein. This portion is the impression of the azygos vein. This portion is the impression of the azygos vein. So azygos vein is drains into the superior vena cava. Azygos vein drains into the superior vena cava. This is the large venous channel and ultimately drains into the superior vena cava. And with the superior vena cava, it ultimately drains into the right atrium of the heart. Okay, so আমরা 5 impression জানলাম: inferior vena cava, superior vena cava, azygos vein and the right brachiocephalic vein. Okay, আরেকটা ইমপ্রেশন দেখো এখানটায় আছে, এই জায়গাটা apex of the right, near about the apex of the upper part of the right lungs. Okay, this portion is the impression of the right subclavian artery. Right subclavian artery. So here is the right subclavian artery. Here is the right subclavian artery. Okay, right subclavian artery. This is the superior vena cava. Okay, so this is the azygos vein. This is the superior vena cava. This is the right subclavian artery. Okay, then just behind the hilum and the upper part of the apex of the lung, there presence of the trachea. There is presence of the tracheal impression. There presence of the tracheal impression. এই যে ইমপ্রেশনটা দেখছো এটাই হচ্ছে tracheal impression. Tracheal impression. Okay, tracheal impression. Okay, just behind the tracheal impression there is another impression. This impression is called the esophageal impression. Esophageal impression. Okay, this is the esophageal impression. Okay, and this is the up to here. This is the tracheal impression. Lower part there is no tracheal impression because trachea is divided into right and left principal bronchi. Here the trachea ends, so there is no tracheal impression below the hilum of the lungs and the pulmonary ligament. So their presence of the esophageal impression from the apex of the lungs up to the just behind the pulmonary ligament and the hilum of the lung. That means the posterior relation. There is presence of the esophageal impression. There is the tracheal impression. Trachea up to here divides into two divisions. On the right sided right principal bronchi, there is a left sided left principal bronchi. Okay. Tracheal impression এখানেই শেষ হয়ে যাবে. Tracheal impression এখানেই শেষ হয়ে যাবে. Okay. হ্যাঁ, এখানেই শেষ হয়ে যাবে.
Posterior border of hilum বললে না?
Yes.
So ওই জায়গাটা posterior border of hilum,
কোনটা বলো?
এই যে এই border.
হ্যাঁ, this is the anterior part of the hilum. This is the posterior part of the hilum. Okay, this portion is the hilum of the lung.
Okay.
This portion is the hilum of the lung. This portion is the hilum of the lung. Okay, so this is the esophageal impression.
Right.
Okay, then one nerve is there. The name of the nerve is the phrenic nerve. But the nerve, there is no direct impression of the lungs. There is no direct impression of the lungs, but the phrenic nerve is related with the superior vena cava, right atrium, and lies with the inferior vena cava. So this right phrenic nerve is related with the superior vena cava, right atrium, and the inferior vena cava. Okay, and the posterior part with the relation with the trachea and the esophagus, another one nerve is there. The nerve is the vagus nerve. The nerve is the vagus nerve that goes posterior to the hilum of the right lung. This nerve related with the anterior to the hilum of the right lung. That means the right phrenic nerve but the right phrenic nerve, there is no impression in the right phrenic nerve, because nerve is the very this just like a thread, very fine thread, looking like the fine thread. Okay, so there is no impression, no question of impression, but this right phrenic nerve is related with the right superior vena cava, right atrium, and the inferior vena cava. Okay, and this nerve goes behind the, so this nerve, so the right phrenic nerve goes anterior to the hilum of the lung, and the right vagus nerve goes posterior to the hilum of the lung, and this is related with the esophagus. Okay, because এই esophageal opening দিয়েই কিন্তু ওটা এন্টার করছে abdomen, মনে আছে? What are the structures related with the esophageal enters into the abdomen? Esophagus. Main structure is the esophagus. Then the vagus nerve, আর একটা কি? Left gastric artery. Left gastric artery. Okay, so division করতে হবে. This is the hilum of the left lung. This is the pulmonary ligament. Okay, so here is the this opening is the artery. This is the opening for the pulmonary artery. Then the bronchus. Then there is presence of the bronchus. That means the there is no only left principal bronchus, because there is no bronchus above the pulmonary artery. In the pulmonary, in the right lung, there presence of the two bronchus. There presence of the two bronchus, epicardial, hypercardial. Here only the one bronchus. So this, the name of the bronchus is the left principal bronchus. Then presence of the pulmonary vein. Then presence of the pulmonary vein. This is the lower pulmonary vein, and this is the upper pulmonary vein, or upper left pulmonary vein. This is the lower left pulmonary vein. This is the upper left. This is the lower left pulmonary vein. Okay. Then the mediastinal structure of the left lung. The mediastinal structure. What are the structures related with the left lung? That means the mediastinal surface. Here the main structure is the heart. That means the left ventricle of the heart. Here this is related with the left ventricle of the heart. Left ventricle of the heart with the aorta. With the aorta. So left ventricle থেকে কি arise করছে? Aorta. So left ventricle of the heart. Then there is ascending aorta. Then there is ascending aorta. Then this is the arch of aorta. Descending thoracic aorta. This is the descending thoracic aorta. Okay. So the left ventricle of the heart. So the left ventricle of the heart. So there is a cardiac. So there is the cardiac notch. This is lingula. Here presence of the left ventricle of the heart. Then there, from the left ventricle of the heart, from the left ventricle of the heart, which big vessels arise? Ascending aorta. Then ascending aorta. Arise ascending aorta. Then there is arch of aorta. Then there is descending aorta, thoracic aorta. Okay, descending thoracic aorta. Then what are the branches of the arch of aorta? What are the branches of the arch of aorta? No, brachiocephalic vein. Only the brachiocephalic vein. Okay, brachiocephalic, sorry, brachiocephalic trunk, not vein. Brachiocephalic trunk. The brachiocephalic trunk, then brachiocephalic trunk divides into two divisions. One is the right subclavian and the right common cavity. One is the right subclavian and another is the right common cavity. So in the Gray's anatomy, there impression in the brachiocephalic vein. Then there is impression of the left common carotid artery, and then there is impression of the left subclavian vein. In the right lung, compare with the right lung, there presence of the, this is the right atrium of the heart. Then there is the inferior vena cava. With the relation of the superior vena cava, there is right brachiocephalic vein. Right brachiocephalic vein. So there here the impression of the right brachiocephalic vein, here the impression of the left brachiocephalic vein. So there is impression on the right side, there presence of the right brachiocephalic vein. In the left side there is left brachiocephalic vein. No, vein, left brachiocephalic vein. Okay, right side right brachiocephalic, left side left brachiocephalic. Okay, then there is left common carotid artery, left common carotid and the left subclavian. Left common carotid here, left brachiocephalic vein in the right side, right brachiocephalic vein, and there is the right subclavian artery. Here first is the left brachiocephalic vein, then there is the left common carotid and there is the left subclavian artery. Clear? Not clear hole abar bolo. Here presence of the here is the left ventricle of the heart. Then there is ascending aorta, arch of aorta, then
descending thoracic aorta.
So ascending aorta lies above the anterior to the hilum of the left lung. Then there is arch of aorta which arches above the hilum of the left lung. Then the posterior part of the hilum of the left lung and the pulmonary ligament is the descending thoracic aorta. Descending thoracic aorta. So in the left lung there presence of the arch of aorta. In the right lung there presence of the azygos vein. So the azygos vein drains into the superior vena cava. Here is presence of the arch of the aorta. Okay. So here is relation in the superior vena cava and the left right side brachiocephalic vein and the right subclavian artery. Here is the left brachiocephalic vein, left common carotid and the left subclavian artery. Left subclavian artery. Okay. Then in the posterior most in this part there presence due to the arch of aorta, there the tracheal impression is not seen but seen only this part, this area, the tracheal impression. This is the tracheal impression. That means the tracheal impression lies just behind the left subclavian artery. So here presence of the left subclavian artery, then the tracheal impression, and behind the tracheal impression there is the esophageal impression. Here presence of the esophageal impression. Here is also esophageal impression. Here is also esophageal impression. So here is tracheal impression, then the esophageal impression. Okay. So this is the arch of aorta, descending thoracic aorta. Then there is esophageal. Okay.
So it is the tracheal impression.
Tracheal impression is there up to here. Up to here there is a tracheal impression, but the posterior part of the hilum of the left lung and the right lung and the right pulmonary ligament, there presence of the esophageal impression. There is the esophageal impression. Okay. In the right lung there presence of the right phrenic nerve, just anterior to the hilum of the right lung. In the left lung there presence of the in the left lung, there presence of the left phrenic nerve. There presence of the left phrenic nerve. Okay. But the impression of the nerve is not seen. Okay. Then in the just posterior part of the hilum of the left lung and the pulmonary ligament, there presence of the left vagus nerve. Left vagus nerve. Okay. Another nerve arises from the left vagus nerve. The name of the nerve is the left recurrent laryngeal nerve. This nerve supply the larynx. Larynx is the sound box. Okay. So this nerve, suppose this is the arch of aorta. This nerve relation just below the arch of aorta. Just below. Suppose এটা কিভাবে দেখায়? Suppose here presence of the vagus nerve. Suppose এখানে vagus nerve টা আছে। ওকে। এবার কে গ্লাভস কে পরে আছে?
স্যার গ্লাভস
পরবো। একজন পরলে ভালো হতো। একজন পড়ো গ্লাভসটা।
বারবার দুটো
এই আর্চ অফ অ্যাওর্টা, এই যে আর্চ অফ অ্যাওর্টা আছে, এই আর্চ অফ অ্যাওর্টার তলা দিয়ে ভেগাস নার্ভটা, এই রেকারেন্ট ল্যারিঞ্জিয়াল নার্ভটা অ্যারাইজ করছে। রেকারেন্ট ল্যারিঞ্জিয়াল নার্ভ অ্যারাইজ ফ্রম দ্য ভেগাস নার্ভ। সো recurrent laryngeal nerve is one of the branch of the vagus nerve. Okay, this nerve supply the larynx sound box. If this nerve is paralyzed, then we
No
cannot
sound.
talk properly. Okay, অনেক সময় দেখা যায় যে আফটার প্যারালাইসিস যে মানুষের কথা বলার ক্ষমতাটা কিন্তু
হারিয়ে
আস্তে
যায়।
আস্তে কমে যায় প্যারালাইসিসের পরে, সেক্ষেত্রে কিন্তু লেফট রেকারেন্ট ল্যারিঞ্জিয়াল নার্ভ প্যারালাইসিস হয়। ঠিক আছে, দেখো, suppose this is the arch of aorta, this is the arch of aorta, this is the vagus nerve, and from the vagus nerve recurrent laryngeal nerve arise. Suppose this is the arch of aorta, this is the vagus nerve. Okay, from the vagus nerve, vagus nerve the recurrent laryngeal nerve arise, and which arches below and which just below the arch of aorta. So the recurrent laryngeal nerve arise from the vagus nerve, and which relation, the relation of the vagus nerve and recurrent laryngeal nerve and the arch of aorta in the inferior relation. So after arising from the vagus nerve, this nerve goes below the arch of aorta, and this nerve directed slightly upward. Then this nerve directed upward. Okay, so বোঝা গেল রিলেশনটা। সাপোজ দিস ইজ দ্য আর্চ অফ অ্যাওর্টা, দেন দেয়ার ইজ দ্য ভেগাস নার্ভ, ফ্রম দ্য ভেগাস নার্ভ রেকারেন্ট ল্যারিঞ্জিয়াল নার্ভ অ্যারাইজ। ওকে, এন্ড দিস নার্ভ goes relation in the lower part of the arch of aorta, lower part of the arch of aorta. So in case of disease in the arch of aorta, there disease in the arch of aorta, if there is abnormal fusiform swelling in the arch of aorta, that causes the sometimes damage in the recurrent laryngeal nerve. দেখবি যাদের অনেক সময় কার্ডিয়াক ডিজিজ থাকে তাদের কিন্তু হোর্সনেস অফ ভয়েস ক্রিয়েট হয়। the hoarseness of voice ক্রিয়েট হচ্ছে কেন? due to the presence of the recurrent laryngeal nerve. Okay, so this is the relationship in the hilum. So the hilum, this is the relationship in the mediastinal surface of the left lung. Okay, আবার দেখো রিলেশনটা বলছি একবার। So this is the left ventricle of the heart. This part is the left ventricle of the heart. Then there is ascending aorta. Then there is arch of aorta. Then there is the descending thoracic aorta. Here the branches of the arch of aorta are there. So left brachiocephalic vein is the right, and the left brachiocephalic vein unites together to form the superior vena cava. But here's the relationship, in the relationship there presence of the impression of the left brachiocephalic vein. On the right side there is the impression in the right brachiocephalic vein. On the left side there presence of the left brachiocephalic vein. Then there the impression of the left common carotid and the left subclavian. Left common carotid and the left subclavian. Then there is tracheal impression. Then there is the tracheal impression. After the tracheal impression, there is the esophageal impression. Okay, esophageal impression. There is presence of the pulmonary ligament, and here is the hilum of the left lung. এবার দেখো hilum of the left lung এর রিলেশন এর ফার্স্ট সুপিরিয়র টু ইনফেরিয়র কি বললাম? pulmonary vein. So this is the pulmonary artery. দেখো pulmonary artery চ্যানেলটা কত লার্জ দেখো। This is the pulmonary artery. Carries this deoxygenated blood. So this is the pulmonary artery. This is the left ventricular blood. যে গ্লাভস পরেছো দেখো, this structure and this structure is different. This is the quite elastic structure. Yes or not? This is the this structure. এই স্ট্রাকচারটা quite elastic structure, কিন্তু দেখো এটা একটা arterial একটা lumen. This is the arterial lumen. Okay, and their presence of the below their presence of the vein. This is the vein. So first there is artery, then bronchus, then vein. This is the superior to inferior relation. Then the anterior to posterior relation. Anterior to posterior relation বলো। হ্যাঁ, yes, এটা radius না না, এটা হাইলাম পার্টটা ওখানটা অ্যাসেন্ডিং আর ফার্স্ট ওয়ান ইজ দা নো দ্যাট এই হাইলাম অফ দা লা, হাইলাম অফ দা লা, দিস ইজ দা হুইচ ভেন
lower
left or this is the left lower pulmonary vein, this is the upper left pulmonary vein, this is the lower left pulmonary vein, this is the upper left pulmonary vein. So the upper left pulmonary vein, then there is in the middle part then pulmonary artery, then the bronchus. So this is the anterior to posterior and this is the superior to inferior relation. এখানে কি ছিল, এখানে কি স্ট্রাকচার ছিল, এখানে স্ট্রাকচার ছিল ফার্স্ট ইন দা if arterial bronchus, if arterial bronchus, then the artery, this is the pulmonary artery, then the high arterial bronchus, then the pulmonary vein, then the pulmonary vein. In yes, this is the right superior pulmonary vein, this is the right inferior pulmonary vein. Okay, so this is the comparative study in between the right and the left lung. Okay, so এই স্ট্রাকচারটা ফিল করো, this is the trachea. Yes, there is presence of the cartilage, there is presence of the cartilage. Okay, এবার দেখো কার্টিলেজটা দেখো পুরোটা কিন্তু রিং শেপ নেই, আবার ভালো করে খেয়াল করো, সি শেপ। আমরা যখন ক্লিয়ার করব তখন হচ্ছে the 16 to 20 incomplete ring, 16 to 20 trachea is made up of the 16 to 20 incomplete ring, that means this part is the incomplete. দেখো this is the C shape, this is the C shape, and here is the left principal bronchus, this is the epithelial and this is the hypoarterial, this is the cartilaginous, and there is the pulmonary artery. Okay.